That's a great question. And this comes up every single day with the way that you can access your radiologist interpretation of your CT, because they use big, long words that people don't understand, and that's perfectly fine. So ground glass opacities are kind of a gray haziness in the lungs. That's what they are. Actually, a radiologist showed me a picture of actual ground glass the other day. It was the first time I'd ever heard it or seen it. And even in med school, they didn't show us that. So it's just a haziness in the lungs. But the bigger question is what causes ground glass? And the list of things that can cause ground glass is about 1,000 things long. So it can be there because of an infection. It can be inflammation. It can be really small amounts of scar, this what we call fine fibrosis, that's just not organized enough to be able to see it as thick white lines. It could be mucus that's in there, right? Our lungs make mucus, and sometimes they cause little parts of the lung to kind of collapse distal to them, and that can cause ground glass. So there's lots and lots of things. It could even be volume, like pulmonary edema or stuff like that. So there's a lot of things that it can be, just like when we see scarring in the lungs, right? That scarring is not a specific diagnosis. There's a list of things that can cause the scarring. And so we have to work backwards from what we see on the CT to what we see on other testing to what patients are telling us is going on with them at that time that they had that scan to try to figure out what those things can be.